All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is our third talk for today. This is our chit chat. So let's talk about it. Carolyn, hello. You are the first one. Okay, so here are the things that I thought were interesting. How about we wait for a little bit? So nowadays, YouTube has kind of started to reduce the exposure of the channel. So sometimes people don't get the notifications. Anna Strange is here. Hello, Anna. How are you? Trevor is here. Hello. Danielle is here. Hello. Diaz is here. Hello. Chris is here. Carolyn said just me. Well, there are more people now, Carolyn. So Mr. J is here. Rubies is here. Anna Marie is here. So let's talk. So the first thing, the second dose. So since I got the second dose this morning, of course, it seems like I'll have more symptoms tomorrow or maybe later today. But so far, what I have gotten today is the same thing as I got with the first shot, and that was fatigue. I just didn't want to get up. Even today, if you may have noticed in the previous talk, I just was not able to go in a more energetic way. So it kind of made me so tired that I was just on the bed and at 2 or 3 o'clock in the day. And then I didn't want to come out of the bed. I just wanted to just be there. So that was one. The second thing is when I walked, I felt that muscles were kind of, I had to intentionally move my muscles and they were saying, I don't want to move. So that tiredness and fatigue, that is what was very, very detectable. And then I developed some headache. In between, I developed some runny nose, but I'm fine, as you can probably hear from my voice. Did become feverish. I still feel that I am feverish, but I haven't taken my temperature. But there is a feeling, and sometimes when we are feeling weak, we feel feverish as well. So it is not necessary that we have the temperature. And I have, of course, the arm pain. It is not as bad. I can still move it. I'm actually touching where the injection was. So it is not sore like too bad. But still, I have an arm pain. And that pain sometimes just radiates towards my hand as well. And I feel a little discomfort here. And then it becomes okay. So this is what I have for the second shot. Not too bad. I'm generally fine, but just want to be, just I'm tired. And on top of this, my plan was I would just continue to lie down today and rest. And then Dr. Corey reached out and he said, I cannot find my video editor, and the video that he did yesterday, he wanted those to be put together in one video. So he then asked me that, can you help me do that? So I actually sat down and I edited those videos before. If I went to my editor, he would come back next week. And Dr. Corey wanted it today. So I actually edited that video and uploaded it to my YouTube so you can download it. So that is the work that I did. How is everyone? I also want to share a very, very interesting thing. So remember, we talked about my family members who got COVID. And so 3 members, they got COVID. Then they kept thinking this is something related to vaccine, but there was just one person who got the second dose, but all 3 of them became sick. So one of them was sick and then others became sick. Interesting thing is that because they kept thinking it is something to do with the vaccine, they didn't bother telling me. Usually they reach out and they say, hey, Mobeen, this is what's going on. So when they told me, it was about, I think, 4 or 5 days. I haven't really asked them exactly how many days, but 4 or 5 days is what they said. We've been having cough. And they reached out because a cough was bothering them now. They were upset about it, that I'm just coughing all the time. So I started Loofymectin, but high dose, 0.4 milligram per kilogram body weight. Today was their second day. So yesterday they took it, or day before yesterday they took it. Today, when I called this morning, I was calling to say, They said we could not get fluvoxamine. So I was calling to figure out if they could get fluvoxamine. And so I called in, and my mother-in-law was just speaking like normal with me and all happy and dandy. And so I said, how are you guys doing? And she said, none of us has cough anymore. So I said, no cough at all. So I wanted to make sure they're fine. I said, so did you get the oxygen oximeter? They said, well, the oximeter was also not there. We're going to go get that today. And I said, yeah, can you get fluvoxamine as well? And then she said, but why do we need all of this? We have all become fine. So within one night, with Loofymectin, all three of them. So, and they are different ages, they are different body weights, they are different comorbidities. All three of them became okay in one night with Loofymectin, to the point where they were saying, why do we need any other medicine now? Why do we need to go get an oximeter? We are feeling fine. There is no issue with breathing. There is no cough. We are fine. So that was quite an amazing thing for me to experience. Then let's do some chit chat as well, but I want to show you something fun. And that was the comments on my video. So I want to once again make sure that I am clear on this. I am a pro-vax person. I'm not an anti-vaxxer. And the only thing I have kept throughout this year is that I have always tried that I do not badmouth anybody who does not want to take a vaccine. It is their decision. It is their community's decision. It is their governments, their employers. It is not my part to say one should take vaccine or not. I take vaccine. That is my example to say I think vaccine should be taken. But other than that, I do not take sides. And the reason I did that, I deliberately did it. I have been listening to some other doctors who have taken positions very strongly. I deliberately did it because these books over here, they don't mind who picks it up and uses it. They don't say that you should be an anti-vaxxer or a pro-vaxxer or this religion or that religion or this belief or that belief or this color or that color. They are a book. So I have always said that we are a book which present information. So you would see many folks who are upset with me that why did I get the jab? And some say that that means everything I've presented is wrong. So one, I want to make sure that we all know that I have always said that I am a pro-vax, so never try to hide that. And secondly, the information about ivermectin or vitamin Ds or other things are all very valuable and useful. And having vaccine does not reduce their efficacy, and having them does not reduce a vaccine's efficacy. I believe in whatever tools you can have. I still might end up with a side effect which would be bad for me from the vaccine, or I might still get the COVID and that might be bad for me. So there is still no guarantees. So with this, the comments that were here, some of them actually made me laugh. So I'm sorry to those who commented to make me upset, but actually they made me laugh. So some of them were very, very interesting. So for example, so these are all, so 99% comments were supportive, loving, caring. And that is what I think we are. We are that community who is very well informed. We make our own choices, but we are very caring for each other as well. And so this is very interesting. So Dawn says, best wishes to you and your family. Your contribution to our pandemic pool of knowledge is immense. If you were a UK citizen, I would nominate you for a title. Arise, Drbeen. Best wishes for Highland Bean. So that is my title. Although there is another title over here, but that made me crack up so much. The title given was Guinea Bean. So somebody said that you're taking part in this experiment, so you're a guinea bean now. So some more folks were happy about that. So then, and as you can see, 99% are awesome and great comments. This was important. So Darago Sullivan said that don't push yourself tomorrow, just just rest. Then, so there were some comments which were like, okay, rest in peace, Dr. Bean. So, hi, Dr. Bean, I wish you safe recovery, question mark. I love you so much, my friend, and I want you to know that no matter what happens, no matter what happens, you have done the planet the highest service in being non-selfishly doing your best to help us all understand difficult principles in medicine. So, Mikhail, thank you very much, and hopefully all will be fine. So, Rajesh is here, all the best. Pam, so thank you very much for rolling up your sleeves and taking a shot. So, Mikhail said to someone else in the same commentary, in this comments, that Dr. Bean took it, he took one for the team. So it is, that made me laugh as well. So I did it for me and for everyone else who can't do the shot. Please be careful. Good luck. So there were three groups. One group was very angry. One group was that, hey, I am an anti-vaxxer, but I respect that you wanted to have a vaccine. Very good for you, and wish you luck. And then there was majority who said, hey, great, good job. So Patricia got it last week. Lars, why did you get the vaccine? Now I feel worried about your health. You're a real fellow human being with who I really appreciate. So this is someone who doesn't want the vaccine, but they are also not saying rest in peace, Dr. Bean. They're actually concerned that, hey, I hope you stay safe. And so thank you very much. Praying for an uneventful recovery. Very best wishes to no side effects. And so thank you very much. I just wanted to share some of these. So Jeff says you're an incredible doctor. Thank you, Jeff. So happy that you're fully vaccinated. Yes, I'm so fully vaccinated and hopefully not fully protected yet. And I made one more comment in the morning. I talked about 95%, and I said, out of 100 people, 95 will not have will be protected. And so, of course, that was a loose statement because relative risk and absolute risk and the comparison to the placebo and then saying likelihood of this compared to that. I didn't say that. I just casually said this. And so some people became upset about that as well. Congratulations. Wishing you the best. So fingers crossed. Take care of yourself. You'll be fine. So very good. No vax for me or my family. You look a bit flushed. So some folks said that I looked flushed. Maybe. Comfortable 24 hours. Congratulations. Safe journey. Wishing you very best. Way to go. Bless you. You have the most information and the best of any of doctor information. Thank you very well. So thank you very much. Godspeed. Congratulations. And good luck. Congratulations. So this all is awesome. And then you would see as you continue to scroll down, lots of fluids. Happy to see this. Best of health. You're a good man, Dr. Bean. I'll pray for you. So check this out. Gulag says, it's been really nice, doc. So meaning, hey, it's nice knowing you. So there's another who actually said that. So that was funny. God bless and protect you. Best of luck. All the best. Congratulations. Good for you. I'm still worried because additional effects of vaccine may take years to appear. After I saw your interview with Dr. Corey, I respect 100% what you wanted. I think there was, this makes him a phony. So Sarah says, this makes him a phony. This shan't won't protect him against anything. So again, it's really not about being phony here and trying to have Dr. Corey. I don't think that Dr. Corey is also talking against the vaccines, but I would let him explain his position. Talking about ivermectin or talking about vitamin D or other supplements, they are actually good. You don't want to have a vaccine or want to have a vaccine. They are still good, very important, critical pieces of protecting ourselves at this time. Take care, sir. I had both Moderna jobs. You got your second Moderna. Oh my, I hope you do well and then that you are around in the future. So when the next strain of virus comes and your natural non-selective immune system may be weaker because of Moderna job you receive. So this is Geert talking, right? So he said that innate arm will be gone. No mRNA junk for me. I'll stick with my supplements. So we have great videos about supplements as well, I believe. Praying for you, brave man. You're in effect part of an experiment. Seeing your interaction with Dr. Korean group, I thought you didn't believe in these EUA-only vaccines. Do you really think they work? So again, I do not know. FLCCC would have to clarify their position, but I don't think that there is a anti-vaccine position. There is a pro-ivermectin position, which is important, which I think WHO should take it up, FDA should take it up, CDC should take it up, the world should take it up. I just talked about ivermectin and my family. So they're not mutually exclusive. So somebody had asked me to start taking medicines right away. So Ken said, do me a favor and don't take anything. Take the opportunity to see what happens to people. So this was this. And then, great job. Do you have a choice of which vax to get? So I did not. So when I went there, they said Moderna, and that's what I got. So undecided and nervous. I actually felt that as well, that, hey, who knows? I mean, it's not written on me that I won't get a thrombus or I won't get a severe side effect. And today they put a red dot on me because they said, did you have allergies? And I said, with sulfur drugs. And they put a red dot saying you could get anaphylaxis. They sent me to a doctor who explained it to me. And I humbly listened and understood what she was saying. And then she said, stay here for 30 minutes instead of 15. So, so doctor and donkey at the same time. Grab a family member, friend, or taxi, drive you home. Divine alone is what I do. Can't rely on anyone. But I got the brains of a dog, hoping to see you. So Eric has always been very, very fun. He supports the work very often as well, and he has very fun comments in the coffees as well. so it cracks me up. Heather says, I don't understand why you get this, but I support you. So see, this is someone who's saying, hey, I don't want to, or I don't want you to do it, but fine if you wanted it. So somebody said about prion disease. So I think I should talk about prion disease because this is something that is coming up very often. You're looking flushed. I guess I'm surprised, but this since he's been talking about other safer alternatives. So yes, and this is also an important word. And I thought speaking out against corruption was ballsy. So once again, speaking out against corruption. For example, I believe right now that ivermectin should be available. Should be available in the US, should be available in India, should be available everywhere. That has nothing to do with having a vaccine or not. You can make a decision for vaccine the way you like. I know that the way vaccines are, I can put my trust. So Repent says, dear God, Dr. Bean, I'm so worried for you. Did you have to do this? So thank you very much. I think I'll be okay, but we'll find out in a few days. So Mariette says, I had no side effects. And so if we keep going, I wanted to see that one which said, that actually made me laugh. And that was rest in peace, Dr. Bean. So Alex is saying that, hey, your wife had side effects, so now why are you doing this? Doctor, you're turning shiny. This was weird when I made this video with that camera. That video looked so odd. I actually was shiny on it, which was strange. So Sean says first night and second day may be rough. So thank you. I would try that it goes okay. Paul Burke is here. Thank you for sharing. Glad to see you fully vaccinated. And so thank you very much. Congratulations. Rest. Glad you got the second one. That is, I believe, Bambi, right, from UK. Bremen playing both sides. So Sarah said, so Sarah is the one who's really upset. Bremen playing both sides. Can't believe you got the shot. Wow. Completely brainwashed. No, not brainwashed. And then, geez, man. So this is where the DSO became upset that I said 95% efficacy in that loose way. So I'm just going to pour you. Listen to Dr. Bhakti. Way to go, Dr. Bean. I had my second Moderna. We got the jab as well. Why did you get the vaccine? I've been watching your show, so I'm shocked that you got the vax. All this talk about the treatments, ivermectin, guess I'm disappointed. And I believe here, he's always said that you got, so I had always been clear on this one. So anyways, so somebody just said, why? So apologies, but I believe in vaccines. And this is the one. Lee Zhu says, rest in peace, Dr. Bean. So the thing is, correct, these are new vaccines. We do not know what would happen. I have no idea. Today, I'm kind of sitting with you, laughing, smiling, and tomorrow something bad could have happened. I have no idea. So the point is not that. The point is we should do whatever we can to protect ourselves, protect the people around us. If this is something you don't believe in, at least you would not be bad-mouthed by me. You decide, and then you decide better. You have the right mental faculties as well. Jared said, sorry, I'm unsubbing. The good doctor is now part of the experiment. There was one more which said, you are a guinea bean. So that was a new term, guinea bean. So then Rose said, really, you talked about the vaccine and here you are. You took it. I'm so disappointed. I have actually been talking about the vaccines, their structures, their efficacies, how they're made, their side effects. I have always kept ourselves aware of it. The thrombosis, I think I was one of the early ones who talked about thrombosis. And I got so much heat by the pro-vaxxers to say, why are you talking about thrombosis? And then the whole world acknowledged that there is this problem and we need to fix it. And for example, in the US, they said with the Johnson & Johnson, there is a problem, but till to date, remember in the article that I read, they said next week we'll talk about the symptoms and how to manage it. And till to date, there is no such further follow-up. Ideally, they should have come back and said, here is what you need to do, here is what you need to look for, and here are the tests to be done, and here is how to manage it. They didn't do it. That was just a appeasing statement so people don't make noise. So I have those things in my mind as well. But that is information that I want to share with you, and I have that information as well. And then I make my decisions for myself, and I hope you make decisions for yourself. You're not a thinking being. Hope you're not practicing. Oh, well. All the best, Dr. Bean. You're a great guinea bean. So this is the one. This was the other one. Charles says, all the great, Dr. Bean. All the best, Dr. Bean. You're a great guinea bean. And then somebody responded and said, Dr. Mubin Sayed is now being called a guinea bean. Sounds about right. Kudos to you, Dr. Bean. But I personally will not partake in this global human experiment. So anyways, you have lost all credibility. So Esperanza became very upset as well. Anyways, so these were some of the hammering that I had this morning. Okay, so how are you doing? Bored? Or it is actually fun. The previous one, so after the first shot, I got thousands of unsubs. And then from this shot, I am seeing unsubs, but I'm seeing subscriptions as well. So this is how it is. But I have never tried to deceive. I presented the information and never, ever tried that. Franz says, hammering is a good word and lots of projection. Yes. Skyfrog says, I saw on Dr. Yo's Twitter page that you just bought a yacht with all the money you're getting from Big Pharma with ivermectin. So when can we see a picture of the yacht? Absolutely. I would send you the picture as soon as possible. Actually, seeing all that big money, even my accountant wants to buy a yacht now. Pasi, how are you doing? You have been here after a long time. Artie Chang, I agree. That's why I keep the kid away from the week. Too many people got the virus 3 days. So Fizan says, which pathway is better for vaccine, T cytotoxic or plasma cell? Please take care. So thank you very much for the wishes. Johnson & Johnson vaccine categorically said that our platform or our vaccine helps move more towards cytotoxic T cell, which reduces the possibility of ADE. Now, so there is a good and a bad in that statement. The good is that they're saying, hey, we observed that it goes more towards the T cell, so that cytotoxic T cell, so that is a good one. The bad is ADE is not observed in vaccinated people. So for them to insert that statement in there is kind of just not the best thing to do. Anastas, thank you very much for the super chat. Is there any biology reason that ribosomes making proteins they're not naturally used to with vaccine could have long-term negative effects? No. Ribosome is a chef. So if I go back here to, if I share my screen for a second, you tell me, I'm going to make you a ribosome for a second. So let's say you are a ribosome, and here is your function. You are a ribosome. This is the structure. Don't mind this structure. I always made ribosome like this. So, and we have a contract. And you don't have a thinking brain for this being a ribosome. All your job is that if I say A, you say B. If I say C, you say D. That's all. So now what I do is I send a piece of paper to you. That paper says A, B, A, B. Sorry, B's should not be there. That is your side. So let's say the paper says A, C, A, C, C, C. So that's what I wrote down. What you do is you look at A and you say, okay, you said A, I'm going to say B. So I'm going to put B here. And then you said C, and I'm going to put a D here. And then 2 A's, and I'm going to put 2 B's here. And then 3 C's, and I'm going to put 3 D's. And these are amino acids, so they get connected with each other. Just like a sewing machine kind of stitches things together. So imagine these are all stuck together. They're stitched together. This becomes a thread. This thread, I'm now going to try to see. Imagine this. So this is my cloth cleaner for my glasses. So imagine this cleaner is there. It is actually made up of many, many small threads. So imagine one thread is this D, B, D, B, B thing that I drew. Then what happens is when more and more of this thread is made, it kind of becomes a two-dimensional structure, and then it is mushed up or folded into a three-dimensional structure, and that becomes an enzyme or a protein which would do whatever. So ribosome itself has no long-term memory to know I did something wrong. For example, let's say making a protein from a vaccine is something wrong. Ribosome doesn't know it made something wrong, number one. Number two, ribosome doesn't get structural abnormality by passing an RNA in it. It is possible that when you pass an RNA, that RNA gets stuck in the ribosome, and ribosome does not process. Some part of the RNA gets stuck in it, and ribosome doesn't function anymore. And we don't care if it doesn't function anymore. It would be killed. There'll be a new ribosome made. Our cells make things all the time. However, what you would find interesting is vaccines don't do it. Antiviral drugs do it. So remdesivir-like things do it. They offer abnormal RNAs. For ribosome, they're abnormal. So when ribosome is trying to chew on them, it gets stuck. And then it stops making further RNA. And that is how these drugs help to stop the translation of RNA in the cytoplasm. So what they do is they act like fake raw material. So to answer your question, this ribosome doesn't even know, and that ribosome is going to go away within days, and it has no memory. So this concept of ribosome becoming modified somehow is wrong. Humble Bean says, Sanofi is working on 2 vaccines, messenger RNA and a recombinant protein adjuvant vaccine. How safe do you consider recombinant protein vaccines? Some are already used in seasonal flu. I find them to be safe enough. So if you think about it this way, as you just said, seasonal flu, recombinant vaccines have been out there for a longer period of time than messenger RNA vaccine. Number one. Number two, some folks, again, this is not true for Pfizer or Moderna, but some folks have a issue with, let's say, they don't want to have a vaccine that is built in fetal tissue copies. And many recombinant vaccines, which have a DNA modified and placed in a bacteria, are actually fine. And please also remember that when we say recombinant and when we say DNA modification, this is not our cell's DNA modification. We take a plasmid. A plasmid is a piece of DNA that bacteria has as a superpower. So bacteria are very interesting. So I'm going to tell you something that may gross some of you out. So bacteria, so let's say this is one bacteria and this is another bacteria. Bacteria, sometimes, for example, let's say this bacteria has learned to resist penicillin. And for that, it has its own DNA. But in addition to its own DNA, it has this plasmid in it. Plasmid are pieces of DNA running around, just sitting around, and bacteria can catch them. And these plasmids can give them superpowers. So this is like if you buy a weapon. So the plasmid is like a piece of DNA that teaches the bacteria how to resist something or how to do something. The gross part is bacteria actually do not have sexual interaction, except they do conjugation to pass plasmids to each other, which is kind of a sexual interaction. So they only have sex when they want to give superpowers to each other. So they pass on these plasmids from one to the other through the conjugatory tubes. Otherwise, they don't do that kind of a mechanism. Now, going back to this DNA, this is a DNA which they build in recombinant. It's not a DNA in our body. It's not a DNA change. It is built, then it is placed somewhere. That DNA, piece of DNA, would be used by the bacteria to make the protein that it says, and that protein will be done. It is like this, when we were young and in school or colleges, somebody would come up and write something in a different language and just ask us to, so let's say in their own language, that is a curse word, but they would simply just write it in English and say, speak this. And whoever would speak it, now they do not know that they're speaking a curse in that language. It is the same thing. Bacteria doesn't know what this piece of DNA is. It's just going to pick it up and translate it, and that would make something that may be useful for us. Maybe it's a vaccine for us. So this is how recombinant technologies work. And I especially wanted to talk about this because one of the comment was, now Dr. Mobeen's DNA is changed. Oh, man, if my DNA changed, I would die, or I would have a cancer. I cannot live, no human can live with a DNA changed. To give you an example, when people go on a beach and they have sunlight on them, their DNA is continuously under the skin is breaking. And the result of that is that you would see that their skin, sometimes if they're not using proper sunblocks and protection, what would happen is their skin would start peeling. That is the dead tissue which got dead because of the energy causing damage to the cell, including damage to the DNA. The cell tries to repair that DNA, but if it cannot repair it, it dies. So how can Dr. Mobeen be sitting here with DNA changed and still not be something else? Okay, so that was a good question, Humble Bean. Akash Tiwari says, why does oxygen level fluctuate after recovering from COVID, and what is the treatment for that? So that is kind of a long haul situation. So there is a general weakness as well. So that would go away as you start eating normally, drink a lot of water, make sure that you're still taking your medicines if you need to. Some people may need steroids, but if it just continues to happen for a long time, then this may be a long haul. Otherwise, this is a normal part of the weakness, and it starts improving afterwards as the tissues heal. Dr. Griffin says, Dr. B, your DNA is now more shiny. Yes, my DNA has been. Oh, maybe that is why I was shiny this morning. Yes. Thank you for bringing it up. Scarlett Monahan said, I'm a supporter of ivermectin, but sometimes just need confirmation. If I'm taking prophylaxis, ivermectin, am I safe, protected if I am out and about? And is there a way of checking ivermectin bought in online is real? So that is difficult thing. So I just got another wave of headache. So headache comes and goes. So Scarlett, that is really difficult to say that what you bought was real or not. And unfortunately, there are possibilities of not real. So, not possible other than just if somebody has the COVID, just like my family, and they took ivermectin and they became okay. So, um, just just don't take any risk, meaning stay, do the social distancing, continue to wear mask as well, take the medicine too. I trust the medicine I got here in the US, but I do not know, I can't guarantee every side. Skyfrog says go rest. I'm good so far. Let's answer some more questions. So Fun says, question, quick recovery from high viral load. Quick recovery equals strong innate immunity, no need for vax, right? So first, if you're talking about SARS-CoV-2 virus and somebody recovered from that, then it is generally, I do not understand the need for a vaccine. Although I would always say this, I think folks who've been hearing me, they know that I repeat it every time. There have been people who have said that after the infection, they had long COVID and taking the vaccine helped it. That day, Dr. Yo was talking about that little tweet that I did. He was talking about that 20% of the people in their cohort that they are managing for long haul, they take the vaccine and they become okay. So I think there is a role of vaccine in long haul as well. And that may be because of that little zombie particle that I showed. Maybe vaccine comes in, creates antibodies, and helps clear that out. Now, if you're talking about generally, that hey, I generally handle infections better. So I may be able to handle SARS-CoV-2 better as well. So do I need a vaccination or not? I can't answer that because many of us handle infections very well, and then some of us end up with the cytokine storm as well. If SARS-CoV-2 did not have a cytokine storm and the chances of death the way it has, I would have said, yeah, it is just a normal cold and we are okay. But SARS-CoV-2 is quite merciless. So, Scarlett, I just answered this question a few minutes ago. So Find Liberty says Loofymectin works in one night. So yes, the original Cali study had shown it to work within 24 hours. I think the efficacy was 50% or more virus clearance, and then in 48 hours, 94%. So it does have efficacy. Again, people who know that study would come back to me and say, well, you talked about Cali study and they were using very high dose. Agreed. But now we have a lot of clinical evidence of therapeutic doses to be very, very efficacious as well. Mark says, okay, TVIV is finished. Time for some bean action. Is the bean action liking the video? Akash says, Dr. Bean, great work. I got my first dose of Covishield on March 3. After 8 weeks, got SARS-CoV-2 spike antibodies. Serum test greater than 250. Is it sufficient to avoid second dose or when to take second dose? So you know that my answer there is always as well that you should take your second dose. And I always give the example of UK that they expanded the time between the second doses, but they still have the second dose. The expanded time showed that the first dose went up to 80% or more efficacy, and then the second dose brought it to 94%. And the FDA like organizations had said that any efficacy above 60% is good enough. So you can see that there are messages which may say that first dose is good, but look at me. I did go and get my second dose. So when I got my second dose, how can I ask someone else not to take their second dose? William Goff says, Dr. Bean, would you look at the super chat question I asked at 9:51 p.m. Eastern time? The hour may be different on your end. Okay, so let's see. Okay, so I can only go to the point where those questions have cleared out. So my chat clears out. So do me a favor, write the question again. Patricia says, I am a new cool bean and got banned on YouTube for asking you and Dr. Corey a question after you went offline. Sorry about that. It has been happening to all of us. I guess I'm lucky to be able to talk to you online, but I'm afraid to ask a question. Ask a question. Let's get banned together. It will be okay. Dr. Bean, would you look at my... William, can you please put that question again? Sports Cards says, question, they're saying it's a vascular disease. What is your take on that and possible treatment? Absolutely. So I agree with this, that it is a predominantly vascular disease because the lung damage that is done and the intensity of damage is disproportionate to the intensity of the outcome, the disease and the symptoms. So there is more than just the respiratory damage. So I am actually, Dr. Paul Merrick had sent his draft for pathology for review. So I was looking at that as well, and he was kind of in that direction too. It's still a draft. Let's see. William, I'm going to be looking for your question. So meanwhile, Sports Card says, Dr. Patterson is saying it's a vascular disease. What is your take on it? So correct. So what they're saying is the following. They're saying that somehow the cytokines, inflammatory substances, this platelet activations, the serotonin, the spike proteins interaction with the endothelium, all of that is causing the vascular endothelium to be damaged. And that is what they're saying is a vascular problem. And that would cause these issues. So when you damage the vessels of the lungs, you are going to end up getting respiratory issues. More dots were connected by Dr. Fareed Jalali, who said that, hey, look at serotonin and then the pericytes. Pericytes are the cells that are around the vessels. So somehow the vessels outside has to be damaged for the things to come in. So the pericyte damage was shown, which told me that, all right, if the pericyte is damaged, that's like if my door is broken, then somebody can come in and do things. So vascular disease itself, we know from the 10 months ago when I discussed the imbalance in the blood vessels of pro-inflammatory and anti-inflammatory mechanisms leading to pro-inflammatory outcome, leading to vascular damage. And that I still remember the word I had, the expression I had used was, this is 10 months ago, that it seems like SARS-CoV-2 takes a rake, the rake with that we use to rake the leaves, and goes through the whole blood vessels and kind of just injures them. So that's what it seems to be doing. James Cook says, use less government sanctions, the use of ivermectin. Yes, absolutely. And it's a safe drug. Some folks nowadays continue to make this comparison of Tylenol and ivermectin. Really, how dangerous can ivermectin be to allow it to be used? So I'm still looking at, so here is, William, I hope this was your question. Can you check the relationship of amount of vaccine per case per 1 million of the top 3 countries, or on Bloomberg, also the top 3 and bottom 3 vaccinated states and cases per million? I'm worried. Okay, let's do that. So you have to guide me for what you are trying to get at so that we can see it. So let's say, so you are saying that check the relationship of amount of vaccines per cases per 1 million of the top 3 countries. Top 3 vaccinated countries, or top 3 countries with infection and their vaccine rate? So let's see here. Do you find it interesting? Mainland China, no report. So US 44.7% and 32.3%. So that is one of the top vaccinated country. And if I look at the cases there, William, I think that you're talking more about top infected countries and the relationship to the vaccine. If you are thinking that way, then I can look at that as well. So this is Israel. Israel is, once again, very much vaccinated, and look at this, their cases are gone. Now, if I look at US is now 44% one shot and 32% two shots. And then let's see. So the cases are going down. They're still going down compared to this kind of a wave. So let me see if William has clarified his question. So I'm going to look at Seychelles as well. Some folks are saying to look at Seychelles. Okay, so Denise is saying Seychelles and okay, so let's look at Seychelles and Maldives. Okay, let's do that. Now I need to see how to spell Seychelles. Seychelles. I'm looking at Williams. So thank you very much. Good job with the spelling. Okay, so the cases are going up. They have new cases here as well. And Seychelles, I feel, is 100% vaccinated. Daily cases 5. What is their population? Population. 100,000, lesser than 100,000. And they got 500 cases. And they're, I saw somewhere here, Seychelles. So they have given 120,000 doses, 66.5% population coverage. So they are almost there. They still have some population, but they should reach herd immunity. So they should not have this that is happening. So I think I'll have to look a little more. It is possible that the youngsters are getting vaccines, or people who have become vaccinated are kind of, moving out and about, and society opened up. I'll have to look into it. The good example to look at for vaccine is Israel. Look at US. This should be a good example as well, but I do not know how to explain this yet. I'll have to look into it. The other one is Maldives. Let's look at Maldives. So 32,000 cases. What is Maldives population? $530,000. Okay, so similar number, almost double than Seychelles, but their population is 5 times than that. And what is Maldives vaccination? Maldives. So I don't see their here. So Maldives is 80% vaccinated with 1 dose and 32% vaccinated with 2 doses. So ideally, with this much of vaccination, like UK, they should have a better outcome. So is it that people are not taking care of themselves, or they're not doing social distancing? I have to do some more research on this, because there still are people who do not have it. How is UK? That will be interesting, because UK has started opening their society. So the question for Seychelles and Maldives is, what is the behavioral part of the society at this time? UK is interesting because I thought they have done the vaccination and now they're opening up as well. So they're changing their behavior too. So there are cases, but as you can see, they're very less. So any UK being here, how is UK's situation generally for interaction and opening up the society? And William and Denise, I will do some more research about Maldives and Seychelles. Okay. Patricia says, I cannot find ivermectin pills. Tried 3 websites in election and cannot create an account. So Dr. Corey said the horse paste is okay. Am I? No. So let me show you. If you are in the US, you should be able to get it. So if you go here, Patricia, to CCC. And then go to how to get ivermectin. So do you see here this big red button for donation, and then right below that here is how to get ivermectin. And if you go there, I actually had Dr. Heather with me a few days ago. He is, I think, in more than 40 states now. Dr. Antonatos is also available. There are many other doctors too. So if you wanted to look at this list, I would recommend. So these are the doctors I have talked to. I have no financial interest or commercial interest of any sort with them. Dr. Syed Haider, I think, is one. He writes 32 states here, but I think he said in his interview that he's more than 40 states. And then Dr. Antonatos is here as well. Text to MD. This is Dr. Antonatos, and he will be with us on 10th. And so please give him a call or leave him a text. So Patricia, I hope that this, if you can go to FLCCC and look at this list, that would help further. If you still don't get it, then please tell me and I'll figure out who to talk with. Eric says, so Dr. Drbeen says, so you're talking with Paul. Eric says, but does IV need prescription? So IV needs prescription, for example, in the US, yes. I'm sure that in other countries as well. Danielle Elgart says, new studies show spike proteins damage cells. How are the spike proteins not damaging two cells? So your question is they damage cells. That is understandable. How are the spike proteins not damaging two cells? So they will be damaging. So the study that is out there, the basic concept of that study was the following. What they said, what they were trying to prove was that the spike protein itself is not just to bind with ACE2. That's not the only function of the spike protein. They were saying that the spike protein, when it binds with ACE2, it can actually cause other pro-inflammatory outcomes that cause vascular damage, for example. I have talked about it 10 months ago, and the reason I talked was that some of the cool beans may remember, on the endothelial surfaces, this is why I'm not surprised about it. I talked about it 10 months ago. On the endothelial surface, there are receptors for ACE1 and receptors for ACE2. And one is pro-inflammatory and one is anti-inflammatory. ACE2 is anti-inflammatory, and ACE1 is pro-inflammatory. So when the virus binds here, it kind of causes an imbalance between these two. There is another newer mechanism that I did not talk, and that was that they're saying that some parts of the spike proteins themselves can irritate the cells, and which would then cause the damage. Then there is a third piece which we also know, and that is that if there is a piece of spike protein that is expressed by a cell as an antigen presentation, then it is possible that the cytotoxic T cell will connect with that and kill the cell. And that would be, once again, I believe cool beans would remember, perforins will be thrown at the cell. That would cause perforations or holes. Then the granzymes will be thrown in the cell, or grenades, as I call them. And these granzymes would then cause the cell, they would go and activate the caspases. Caspases are the proteins. So what happens is there are proteins called ubiquitins. Ubiquitins are activated that activate the caspases. Caspases, I call them Casper the friendly ghost. So the caspases cause the cell to die. It causes cells to commit a suicide. So this mechanism is also known for a long time. It is just as that I think now researchers are finding so much of the role of spike protein in all of the pathology that is interesting. Now, to your question was, how will they not cause damage? I cannot answer that because I do not know that they will not cause damage. They participate in damage. So MS Pemi says, one of the docs, their practice got shut down and lost their medical malpractice last night. Wow. Was that because of ivermectin? So yesterday somebody had made a comment. I talk about ivermectin. We had Dr. Corey, and somebody said that Dr. Mubin may be worried that the talk is on my site. And I responded that for one sentence of bravery, thousand such sites can be sacrificed. There are people who are dying. And I thought afterwards as well to think that, all right, there can be many things. There can be people who, just you saw in the comments, there are people who are saying, rest in peace, Dr. Bean. So there can be people who could come back and who will do negative things. And tell me this, is this not an exceptional time? This is, at least in my age, in my lifetime, this is the worst time humanity is suffering that I've seen. There may be the wars and others where majority of the globe is okay, but one nation, one community is suffering, and others just say whatever. At this time, the whole globe is suffering. And I feel that personal interest at this time, as much as it is important, is still less important than the societal interest. So I think we should keep doing this. Maybe I actually thought that maybe somebody would come back and just this malpractice, maybe they'll arrest me and say, why do you talk about ivermectin? But that would not be an arrest for doing something wrong. So I would not be ashamed of it. Similarly, if some damage occurs, my business got a lot of damage. So generally, I understand this, but at the same time, I want to stand in the ring more and continue to do this as long as I can. So either the the pandemic would finish in next few months or 1 month or so, at least in the US, and then Cool Beans would come back and they'll say, you know what, enough of this, done, thank you very much, or somebody would come and shut us down. So we'll see. But I'm not. That doesn't drive me. The part, it is part of my subconscious. It is part of my thinking as well, but it doesn't drive me to do something. For example, stop teaching. Okay, so let's see. Let's do a couple of more comments and then we stop. So G Unit says, are you following Pfizer myocarditis in? Yes, so I had to work on that. The problem is I do not have enough data yet. And then we started talking with Dr. Corey and now this one. So let me just put that on top of it. I wanted to discuss that. So 1 second, please. Somehow my computer is totally not working right today. I can't even take notes. It's so much hung. Okay, so I can't take a note. So G Unit, you may have to remind me tomorrow if I appeared tomorrow, and then we'll do it. Bonk Bonk says you must try to get on some big podcast like Joe Rogan. Thank you. I have never tried to go and ask someone. So if somebody reaches out, good, I talk, but I don't ask them. Teresa O'Reilly says, I called doctor on FLCC list. I asked for ivermectin. They said no because I have fatty liver with elevated 3 times. They will give hydroxy, but I want ivermectin. Please advise. So of course, there is a risk in there, but there has no association with liver disease and ivermectin itself. There is a need for titrating the dose because liver is the primary metabolic area for ivermectin. Liver metabolizes it and throws it to the GIT to be eliminated. So if somebody has a liver issue, the dose has to be corrected. So the best thing to do is to reduce the dose. Iram Afshan says, thank you, Dr. Bean, for all. I listened Dr. Fareed Ghazali talk, and it was sort of very technical for me to sum up. Can we have an easy summary? Are you talking about Fareed Jalali's talk? Yes, it was technical, but he's awesome. He's like a medical genius. So yes, I intend to go over. So somebody else, if you please don't mind, can somebody take the note of this? My computer is just not letting me take notes, although it is relaying. To go over Dr. Fareed Jalali's paper and do those cartoony things that I do, and then also talk about the myocarditis or pericarditis in Israel. So, so I'll give you an example of. Thank you, Dr. Booster shots be needed. I hope not. I hope not. Although the vaccine companies continue to say that we'll need booster shots, I think they're managing expectations. I hope not. So I want to comment on this one. So when I was in first year medicine, I went to my professor and I said, I want to take a gold medal in medicine in various subjects. So how, and we call it distinction. So I said, how do I get a distinction? What is the difference from others? And he said a statement that is stuck with me till today. And he said, to have a distinction, you have to be distinctive. And what he meant was that my behaviors would have to be different from others, my study patterns, my study hours, and understanding of the things, and so on. I did end up getting a distinction. I think I topped as well. The same is the truth for pandemic as well. We are in an exceptional time, and our behaviors have to be exceptional as well. We cannot have commoner behaviors at this time. So get to Amar says, hi, Dr. Bean, based on the scientific investigation, did you foresee another pandemic anytime soon? No, I don't. Although variation in India kind of disturbed me a little bit. I thought that we may be moving towards SARS-CoV-3. But looking at their cases nowadays, looks like, for example, Mumbai's cases are going down. So I think we'll be okay. But there is some concern, but I've not reached a point to say, you know what, we are doomed. We'll have one more pandemic. Cool. So how about So good question. Sports cards, Jay. So beautiful question. The question is, can someone recover from this vascular disease? What a beautiful question. So everybody is talking about the vascular disease, but nobody's saying, okay, how do you manage it? So good question. Simple answer. So I'm going to draw it. So let's say here are two blood vessels, and both of them got damaged by this endothelial damage. Now the blood vessels have an inner lining that is called endothelium. Then some of them, major or bigger blood vessels, they have further layers outside of them as well. Capillaries don't have this, but as the blood vessels continue to become big, they have them. Veins do not have them. So medicos here, I'm not generalizing it, but I want to make a point here. So now, if somebody's endothelium got tiny bit damaged, then it is possible that the endothelium would be regenerated and they'll be okay. However, imagine if somebody got so much damage that there is atherosclerosis, or there is scarring of the blood vessel and the walls of the blood vessel. If that happens, or there is closure of the blood vessel because of the scarring, so it just like other wounds that we have, when they scar, they kind of contract. So imagine if this blood vessel has become scarred and contracted and closed. Now this cannot be recovered until you stent it or you do something to it. Similarly here, if there is this atherosclerosis set in the inflammation, or if the scarring has occurred here, then that is not going to be recoverable. This is very similar that some wounds. So if you look at my arm here, I was very young when I had my arm broke, and then I had a fracture, and then they put the plaster, and that plaster was so tight that it caused damage here. So since then to now, I have a scar. So imagine if a blood vessel is scarred, then it is possible that that scar will not go away. So that may not become corrected. This is why early aggressive treatment, do not let severe damage occur. Get the patient out of the situation early on. And the more I'm seeing nowadays, the situations with the the heparin, serotonin, the inflammatory situation with the vascular system, the more I feel that there is a role of steroids a little earlier. Cool. Catherine has a good question. So Catherine says, did your computer get the second dose today as well? So here is what happened. So truth. My computer is a little old computer. And I have less storage on it as well because I've been doing these talks and they are stored on Google Drive, but then some of them are stored here as well. So today when I downloaded Dr. Corey's videos to edit them, and I ran my own editing program, the file that was produced was large enough that it took a lot of space. So my computer doesn't have enough cache hard disk space to be able to work correctly. So it is just doing barely enough to do this talk. That's what happened. So yes, it is Dr. Corey who brought my computer down. So section 1 says, how can we bolster the health of our endothelium so we can lessen our risk to COVID vascular damage? Unfortunately, in this situation, it's not about the health of the endothelium. It is really about the SARS-CoV-2 connecting with the ACE2. And if we get SARS-CoV-2, we can't stop it from connecting with ACE2, which then puts in motion the rest of the issues. So I think more than the endothelium, if our endothelium was not healthy, we just cannot live for a few hours or days because it would start causing thrombosis. More than that, it is the immune system properly optimized. And that is where vitamins that I've talked about, that is where ivermectin-like things. And once again, people are going to look at me and say, you took vaccine and you're talking about, these are not mutually exclusive. They are together. So I think that is how we would look into it. Cool. So Michael says, can vascular damage be limited with addition of ivermectin plus NSE? So the role of ivermectin can be to reduce the inflammation. That can be with ivermectin, that can be with other anti-inflammatory, that can be with steroids as well, depending upon the severity of the person's situation. And the N-acetylcysteine is interesting because it can help break bonds that are forming, especially in the lung area. So they both are useful. Can they be protective for endothelium? I do not know. I think that presence of ivermectin doesn't allow the virus to reach to the point of endothelial damage. So maybe that is how it protects. So Cinch says, can a person with beta thalassemia receive blood from a COVID-19 vaccinated person? So other than receiving blood in general, and if you don't have any problem, the blood is matched and all that is good, the vaccinated person may just have some IgGs as well. So that is like IVIG you got, and that should not be an issue. ET says you're starting to look tired. So more truth. Because I'm fasting, I have not eaten or drank anything since the morning after the vaccination. So I'm kind of getting a little drained. So it's about to finish in another 10 minutes. And I would take medicines plus I'll drink lots of water. Okay, so William Goff says, Dr. Bean, Statista is showing 5,800 breakthrough COVID cases, which isn't surprising, but what I do find surprising is the mortality rate of those 5,800, which is 74 or 1. Is that 74 to 1? So how about, William, can we talk tomorrow if I'm feeling well? And we plan this talk and we figure out what should we talk about in this, and we'll do it together. 1.3%. So William, let's take this up for maybe tomorrow, or not. If not tomorrow, then day after. So for the cool beans, depending upon my situation, I would be either there or not there tomorrow. So please forgive me for that. Do me a favor, please like, subscribe, and share. And there are 3 links in the description. One is to buy me a coffee. So if you don't like PayPal, you can just buy me a coffee. Or there is a link to become a patron. And there is a link to support this work in general. Stay safe and healthy and happy. And I love you all the way your decisions are. and let's go from there. I would see you tomorrow. Bye bye.